Good morning. I'm Dr. Deukmedjian, CEO and founder of Deuk Spine Institute. We're here today on February 10th, 2026, broadcasting probably 4 surgeries today. Our first patient is a young female. She presents to us with severe debilitating back pain of about 3 weeks duration and sciatica down the right leg, and most importantly, a drop foot on the right side. She has zero strength with her foot. She cannot cock her foot up. She cannot push it down. She can't move her toe. She has basically 0 over 5 strength in the L4, L5-S1 myotomes, and she has loss of sensation. So she has a really bad, basically radiculopathy, and her doctors were treating her with steroids and pain meds, and what she really needed was the right type of surgery, which hopefully we can do today. But she is very, very what we call Cushingoid. She's been on steroids for a while, and her body is showing the signs of being on steroids, high-dose steroids. Steroids is not the right way to treat a herniated disc that's pushing on a nerve, causing nerve damage like she has. The right way to treat a pinched nerve is surgery, and especially when you have weakness and numbness. But you have to do the right kind of surgery. Not every surgery works, and the right kind of surgery is the surgery that can treat the problem. In her case, the problem is a foraminal disc herniation at L5-S1, which is basically a herniated disc in the foramen, pinching the nerve. All right, she is not an easy case, unfortunately. She's going to be very difficult to get done. Give me an AP. Her anatomy is such, you can see the facet joint at 5-1 is enlarged. She has a high iliac crust. It makes it very difficult to get to where we need to go. But we're going to do our very best here. Any questions during the stream, you can ask me. I'll do my best to answer them for you. Shot. All right. I have to get around this massive facet. Shot. Which is not an easy thing to do. Shot. Shot. AP. You can see I'm right there, right where the bone is. Just trying to block the needle. All right, we're going to have to go a little bit more lateral. Shot. 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 I think we're off on orbit. Let's fix the orbit. We also have a difficulty because she's got a lot of soft tissue, which makes the surgery much more difficult to do. Shot. Right there near the foramen. Just need to get a little bit further. Again, very difficult because of her weight and soft tissue situation. What I'd like to do, trying to get around this facet. Shot. AP. May have to place another needle, Luis, just a little bit more lateral. Yeah. Yeah, so she's taken the entire spinal needle we normally use, and it's maxed out. Yeah, thank you. Shot. Very, very, very difficult case. I knew this would be a tough one, but she had lost complete strength in her feet. She couldn't move her leg. She was just incapacitated, unfortunately. And we have to do something. So that's why I opted to do her surgery, because it's not an easy surgery to do by any means. And what makes it difficult again is the anatomy. Sean? Her anatomy in particular is very, very challenging. Sean? We're having to use a special needle. Sean? Sean? Any questions, Sean?
At this moment, no current questions.
All right. Well, let's show the audience how a herniated disc can be so painful with back pain and leg symptoms. Sean, AP?
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
That's what I thought. Welcome back. We're still trying to get into this bottom disc. I have not yet been able to do that successfully. Normally we would be in by now, but because of her anatomy, it's made it very challenging. Sean? Back to a lateral. All right. Let's see here. Let me have the stylet. Sean? God. Well, Sean, he certainly didn't do her any favor by loading her up with so much steroids, unfortunately. Sean? Just any way to get better image at 5'1" there? Sean? That's better. That's definitely better. Thank you, Jordan. It is so difficult to get around this facet. No, that's worse. Sean? Sean? AP? AP? Are you boosting?
Yes, sir.
So we're using the absolute maximum amount of fluoro lateral, and we're still having trouble seeing the disc because of how much soft tissue she has. So this is already taking 10 times longer than normal. That's how complicated and difficult this is. But I knew it was going to be difficult to get into. But this is really the best way to fix a foraminal disc herniation, unfortunately, is going from the side through the foramen. Sean? 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 She clearly has some degenerative findings in her facets, which has made it difficult. So she's probably had facet arthritis for years to get these degenerative problems, and that's what's making it so hard to get into at L5-S1. I'm going to have to go more lateral. Wow, I mean, we're so close yet so far away. Give me another AP. Looks like it's right there. The AP is looking pretty good, but the lateral is just not. Give me better boost on the lateral. You got to see the tip of that needle. Yeah, I think we're too far medial. Still have to be more lateral. Sean? 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 Shot. I think I'm hitting the sacrum. Hitting the S1 superior facet. There we go. Shot. Shot. Give me an AP. Well, hold on. Shot. That might be it. Shot. Give me an AP view. That's looking pretty good right there.
Looking for that OR.
We are right at the back of that disc. Shot. Shot. I don't know. Let's see if we're in the disc. Shot. So difficult to tell. She has a lot of soft tissue, which makes it very difficult for our x-ray. Shot. AP. Alright, we got dye in there. Let's see if it's in the disc. Give me an AP. Looks good on the lateral view. Question is it going to be good on the AP view? It is good on the AP view. We're inside the disc. Barely. But we're there. Alright, guide wire. No, not for this. Please, come on. This is not the case to do something like that. Go ahead. Any questions?
At this moment, no current
Let's
questions.
show the audience how we use the DLDR to repair these herniations.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
All right, welcome back. We're in the process now of placing our tube. We are now inside the disc itself at L5-S1 on the right side, which is the side of the herniation. So we've gone basically right through the herniation, and we are now entering that 5-1 disc to repair it. What we want to do is remove as much of the herniation as I can. Shot. The tube is in good position. Again, she's very challenging from a surgical standpoint for any surgeon because of the location of the herniation, her size, her depth of her spine, the anatomy, the facet enlargement, the angle of the L5-S1 disc, the pelvis, the iliac crest. All of these things are making the surgery much harder than normal.
Lights on the scope, please.
I actually let her know ahead of time there's about a 20% chance that I cannot get this done. Nobody wants to hear that, but I give my patients, there's the inflammation. You guys see the red there?
Yes,
That's
we do.
the inflammatory tissue. It's been there a while. She said that her symptoms started about 3 weeks ago, but this disc has been damaged a lot longer than 3 weeks. So we're inside the disc at 5-1. This is all herniation, the blue stuff. It's gonna be a pretty good size herniation, but it's gonna come out in little pieces, right? Because the inflammation has been so severe that it literally just chews up the herniation, the body's inflammatory system, into little pieces. Oh yeah. It'd be nice if we get a big piece, but I don't expect it. It'll be a bunch of little pieces instead. Any questions?
At this moment, no current questions.
Thank you, Jordan. Just want to thank my team. I have the best team here helping me, I think, than I've ever had in my life. The best surgical team. And we have tremendous people at Deuk Spine, nurses, technicians, doctors, and they make the difference between a successful surgery and a failure. The laser is the tube at 12 o'clock. It's very powerful medical grade laser. It's FDA approved. The laser and the fiber are both FDA approved, and they're approved for use in the spine, which is exactly where we're using them. As a matter of fact, everything we use here at Deuk Spine is FDA approved. There's some rumors out there that doctors who do laser spine surgery are not doing FDA approved treatments, but they are. As long as they're using FDA approved equipment, supplies, drugs. And at Deuk Spine, everything we use is FDA approved. So we also have our certification through AAAHC, which is an accrediting body approved by Medicare, our government. and the Board of Medicine. All right, there's a big part of the herniation right there. You saw the inflammatory tissue. We see that quite often. We are inside the herniation right now at L5-S1. And I don't know if you guys remember me telling you at the beginning of surgery, her nerves are being pinched so badly that she can't even move her foot. We saw her yesterday. She had just a little bit of movement, but today there's no movement at all. So she's clearly getting worse. This herniation is very strategic. It's in just the right spot to cause problems for her. Very serious problems. And to make itself very difficult to remove, by the way. All right.
We have a comment and a question.
Sure.
It's a comment coming from Noah on YouTube
Hello, Noah. Welcome to our stream.
saying, there's a comment and or seeking advice saying, I had a disc fusion 3 years ago on my L5-S1.
Yes.
I herniated my L4-5 and L5-S1 in my mid-30s. I am 75 now.
Uh-huh. How can we help you, though? We can help you. If you're having pain in your back, we can help you at Deuk Spine. You can get a free MRI review and a consultation, a virtual consultation with me. You just have to have a MRI scan of your lower back in the last 2 years. And you go to our website, deukspine.com. You upload your MRI images or you mail your CD in. It's easier just to mail your images in. And I will look at those MRI images and I will, with a quick Zoom call over the internet, I can figure out what's causing your pain. And more importantly, we have a treatment to fix it that's ultra minimally invasive at Deuk Spine and very successful. The problem with most treatments for back pain is that they don't work. And that's why we don't do those treatments. We do treatments that do work. Our treatments are pioneered here at Deuk Spine to cure back pain. Back pain has very specific causes, and we know those causes. And more importantly, we can identify them in our patients using a process called the Deuk Spine exam. The Deuk Spine exam is a special set of tests and examination that I perform here at Deuk Spine Institute. It's unique to Deuk Spine Institute. This examination involves examining the patient, examining the MRI images, the report, and coming up with a diagnosis as to what the specific cause of the patient's symptoms are. This is all herniation here. You can see the end plate of L5 on the right, the end plate of S1 on the left, and between them is this giant herniation here. Now, I shoved some of the herniation back in to the disc to get the pressure off the nerve when I put that dilator in. These are all pieces of herniation that are floating up. This is what's crushing her nerve. You could see it on the MRI scan. You have Grabzilla? I would bring Grabzilla into the room.
On the right side, on the right. Right there.
See this yellow coloration here? This is calcium. This takes years and years of damage to the disc and inflammation for this calcium to form. Don't open it yet.
Not open. Thank you.
Just have it available in case I need it. I'd say there's a high chance I'll use it. All right. Yeah, I'd say there's a very good chance I'll use Grabzilla. You can open Grabzilla. So Grabzilla is a special rongeur. Rongeurs are metal instruments that are used to remove tissues in the body that are difficult to remove. You can't use a scalpel. You can't use a scissor. You can't use your hands. So you go for what's called a rongeur. And Grabzilla is one of those special types of rongeurs that allows me, the surgeon, to access pieces of herniation that are more medial. And remember, she had a big facet joint that was pushing us laterally, okay, as we were trying to get into the disc. Made it very difficult. So what I'm going to do is bring in a special rongeur called Grabzilla, and I'm going to try to remove more of the herniation. Now, Grabzilla has an articulating surface. There's a nice piece of herniation right there. You get that?
Yes, we did. And we have a question
Sure.
coming from Lanu on YouTube, asking, the disc has been damaged for at least 5 years. Did she ever mention about car accidents?
That's a great question. I didn't ask her about a car accident, so I don't know the answer to that. Huh? Lifting. Huh? So apparently she was lifting something. 150 pounds? Oh. Yeah, so she was lifting something, a person, sorry, that's what I'm being told, 150-pound person, and then afterwards felt horrible pain in her back and leg. So that's what we believe caused the most recent herniation. But this disc is not normal. You got bone spurs here. This disc has been abnormal for a long time. So she just made it worse a month ago when she was lifting her somebody. All right, there's more herniation there. Not yeah. Any other questions?
No current questions, but we do have a comment from Noah once more on YouTube, following up with his fusion 3 years ago, saying the L4-5 is pushing out on each side according to his MRI.
Yeah.
And his surgeon wants to try an injection, and if it doesn't work, he will do surgery.
Yeah, Noah, you don't need a surgeon's laminectomy or discectomy. Those are procedures that do not work well for patients with your problem. Laminectomy is really a surgery that was developed to take out tumors out of the spine by Victor Horsley, a neurosurgeon, many years ago. And unfortunately, laminectomies cause a lot of damage, a lot of scar tissue to people's spines. So I would recommend you avoid any kind of invasive surgery. But if you're interested, we can do a free MRI review for you, Noah, here at Deuk Spine. We just need your MRI images. So you got to send us a CD or a zip drive with your MRI. And using that MRI, I'll be able to schedule a 10-minute consultation with you. You can do it from home. And we do it over Zoom, during which time I can look at your MRI with you and talk about what's wrong and how to fix it best for you. The best way to fix it for you. A lot of people, unfortunately, just trust their local doctors that they're going to get the very best care, the most advanced care, locally. But unfortunately, it doesn't happen a lot of times. Look at all that scar tissue. There is a lot of scar tissue here. We are looking inside the disc. We were just in there, by the way, and I've got to get more of that stuff out, by the way. All these little pieces I'm taking out are the recent herniation. Excuse me, the old herniation. Oh, yeah. Thought I had a good one there. All these are just tiny little pieces of herniation, but they add up like marbles in a sack. You get enough marbles in a sack and that sack becomes pretty big, pretty heavy, pretty what we call massive. And this patient has an old injury to the disc where she's had herniations before, but none of them were really bad enough to cause symptoms for her. So her symptoms just started recently, even though the injury to the disc is not a recent injury. It's an old injury. So the advantage of transforaminal surgery is you can actually operate medially and you can operate laterally. You can operate both. So the nerves can be pinched medially and they can be pinched laterally. Right now I'm working laterally in the foramen. Because one thing I noticed about her herniation was that it was both medial and lateral when I looked at her MRI. And that lateral component is important to get. If you don't go after it as a surgeon, you leave it there, then the patient won't get as good a result as they do when you go after the lateral intraforaminal component of the herniation. So you can see all this space now I've created by working on the herniation. And I'm going to keep going medially because remember, the facet forced us to start in a lateral position in the foramen, which I didn't like, I don't want, but it happens. You just got to deal with it. So now I'm working my way back medially and hoping to get some more of this herniation out. Any questions?
No
Robert?
current questions, so we do have a comment and or seeking advice from Patricia on Facebook.
Sure.
Saying I have L5-S1 pars and spondylolisthesis, 69 years young, unstable. I use a cane and a rollator. I have gone out from dancing 2 years ago to this. Tailbone pain on the left side of my buttock. Told I had stenosis as well.
Well, we can help you at Deuk Spine, but you're going to have to give us more information for us to help you. So what I need from you is you to submit your MRI so that I can look at it and examine you at the same time. We can do that over Zoom. We offer this as a free service, by the way. We don't charge you any money for an MRI review. You get one free MRI review. We offer it to anybody in the world who wants it for free. It's our way of trying to help people get better. All right. So I need the grabber again. Trying to go more medial, and it's very difficult because of that facet joint that's there. Let me just think here, Luis. Let's take a look laterally. It's looking pretty good. I don't know yet, Dr. Byrne does. This is a very difficult case. It's hard for me to say how much more time I've got. I think I've taken out just about as much as I can. I'm looking for more pieces I can grab and pull out. I'm not really finding much. Let me try the Grabzilla one more time. Got just a little bit there. Nothing to write home about. Any other questions?
At this moment, no current questions, but we do have another comment from Noah once more on
All right.
YouTube saying, I injured my back by lifting heavy parts on a turnaround. I will go to your website and see about my situation.
Yeah. I think that's wise, Noah. Let us try to help you. you know, it's free advice from an experienced spine surgeon. So uh-huh. I mean, that is very difficult. All right. So far we've gotten a lot of little pieces, but really no gigantic pieces that I was hoping to get. We're just now, you can see the view is just in the foramen there. We're in the foramen looking at the disc, looking for more pieces of herniation that I can grab and remove. Grabbing laterally, grabbing medially, and I'm going to have to take another look. Right. So that's kind of epidural. See a little bit of fat there. I think let's have the laser again. Probably a few minutes left. There's a nice piece of herniation right here I'm trying to get rid of. I'd say 5 minutes, Dr. Berndes. A lot of her herniation is lateral. See that? It's pretty amazing. Well, definitely one of the hardest I've ever done. And I've done now. How many of these laser surgeries have we done, Henry?
This would be 2,742.
2,742. That's a lot. And I think this is ranking up there with one of the hardest I've ever done. So, just not finding any more herniation. Looking around. All right. Well, I don't want to leave here and leave anything behind, but I think there's the disc right there. I don't see any more pieces of herniation. I'm going to try to get underneath this ligament here and could try a little bit more in that corner there. All right. Well, we're just about done. No matter what, it's going to take this young lady a long time to recover because her nerve damage was so bad. Let's take a look around. Wonder if I can get any of that out. There.
Somebody recover a little faster than the lower laser disc, or it's about the same?
Upper extremity? You know, hard to say. It depends on, you know, the distance from the nerve compression to the muscle that is affected, right? So if the distance is shorter, then the recovery is probably faster, but it also depends on other factors. Yeah. But all things being equal, I think the shorter the distance from the nerve damage to the muscle, the faster the recovery. All right. A little bit of fat there. But yeah, there's the disc. Wonder. Just cannot. We're in the foramen. I can't get any more herniation out. I don't see any more. I think we're done.
We just have one more question
Scope off. Yeah.
from Faisal on Facebook asking, can the Deuk rhizotomy solve the pain from scoliosis?
Well, Faisal, it can. If the pain from scoliosis is coming from the facet joints, yes, it will. I think this is, there we go. All right, one of my most difficult cases I've ever done, but our patient did very well. We were fortunate enough to finally get in. We did everything through a 1/4-inch incision, size of a Band-Aid, and it's going to take her a long time to recover because this nerve damage was so severe. She had no movement at all in her foot, and I just think it's going to take time to come back. There's nothing I can do to speed that up except do the surgery as best as possible, which we did. The rest is up to God. It's out of my hands. Thanks for joining us. Are there any other questions?
At this moment, no current questions.
We'll be back with another Deuk laser disc repair shortly.
I'm Dr. Deukmedjian here with one of my patients. Now, you didn't travel too far. You're a Florida guy, right?
Yep, about an hour away.
And why did you travel to Deuk Spine Institute? What brought you here?
I was having a lot of pain in my back, probably for about 8 years. I did a lot of research. I was tired of getting talked into just doing physical therapy, and it wasn't working. I tried chiropractic, that didn't work either. I kept researching on the internet, YouTube, for getting relief, and then I happened to come across Deuk Spine Institute, and it got me so interested on his procedures. The techniques are really awesome. They're just a godsend, this whole institute. They're amazing. I got my surgery done yesterday, and I walked out with 0 pain. Incredible. It is amazing the new technology they out there. And I would advise anybody to get a free MRI review. It doesn't cost anything, and he'll give you his perfect, honest opinion. It's just amazing, you know. And it's not a sales pitch. They're not trying to push anything. They're trying to get the information out there on the new technology, and it is so, I guess, invasive. It's crazy.
1/4-inch incision.
Yep.
Your surgery was done with the laser on your lower back. We found a tear that was causing all your pain, and we cleaned it out. And the whole surgery took us 30 minutes, and
Exactly.
you were out of here within an hour. So here you are 1 day later. You got a smile on your face.
Oh yeah, very much.
Now you're an engineer by trade. And how did you kind of think about the Deuk laser disc repair from an engineering standpoint?
It's amazing technology, because I did research other ways of fixing the issue, and it was barbaric to me. So then when I saw this, and I saw the thousands of people out there that had all this done, probably more than that, the years of experience he has, I just felt so comfortable with the technology. And it's just amazing. The technology was so easy to do.
Well, we could have done done a fusion too, and that would have caused more problems for you down the road. Scar tissue, muscle damage. Of course, with fusions, you're on pain pills for a month. Are you on any pain medication today?
Nothing at all.
So you had surgery yesterday, you didn't take any pain meds, and you have zero pain in your back and leg.
Exactly.
Well, congratulations.
It's
Is there
perfect.
anything you want to say to your fans out there?
If you have any problems with your back, you need to come here. His whole staff is amazing. From walking into the front desk, the nurses, the techs, all the doctors, and Dr. Deuk is just
Henry.
amazing. And Henry. We
Don't
have another
forget
Henry.
about Henry. We like Henry's
Yes.
here.
These people are incredible. They treat you with professionalism and they exactly know what to do. They're just really cool people.
Well, you're welcome.
Thank
My
you so
pleasure.
much.
And you're the reason why I do what I do, because
Oh.
I could have retired years ago, but I love helping people like you get your lives back, and your wife.
Thank you. Yeah,
So-
she's happy.
Congratulations.
Now I can get back to the honeydew list.
Oh yeah, not too soon.